A patient enters the labor and delivery unit. She is having a singleton birth and the baby is showing minimal variability on the fetal monitor. Interventions may include all but A. Giving the patient a 500 ml IV fluid bolus. B. Placing the patient flat on her back. C. Contacting the provider. D. Placing the patient on a non-rebreather mask. E. Suggesting that the patient walk with a portable monitor. The answer is B. Placing the patient flat on her back. Increasing fluid and oxygen administration may increase the overall oxygenation of the fetus and result in greater variability in heart rate. It is advisable to change the position of the patient, however, a supine position is not compatible with pregnancy. Contacting the provider is an acceptable intervention given concern for fetal well-being. What is the most common cause of mucopurulent cervicitis? A. Chlamydia trachomatis. B. Nclex gonorrhea. C. Herpes simplex virus. D. Human papillomavirus. The answer is A. Chlamydia trachomatis. The most common cause of mucopurulent cervicitis is Chlamydia trachomatis, followed by Nclex gonorrhea. Human papillomavirus, while it is associated with increased risk of development of cervical cancer, does not cause mucopurulent cervicitis, nor does herpes simplex. Which of the following conditions can result in temporary masculinization of a pregnant woman which resolves after delivery? A. Placental ematase deficiency. B. Growth hormone deficiency. C. Closma. D. Polycystic ovarian syndrome. The answer is A. Placental ematase deficiency. Placental ematase deficiency is a condition that prevents testosterone from being aromatized into estrogen during pregnancy. This results in a temporary masculinization of the mother that does not continue past delivery. Neither closma nor growth hormone deficiency result in masculinization, and masculinizing symptoms of polycystic ovarian syndrome often improve during pregnancy, rather than getting worse. Which of the following conditions presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy? A. Bacterial vaginosis. B. Lichen sclerosus. C. Contact vulvitis. D. Herpes simplex. The answer is B. Lichen sclerosus. Lichen sclerosus is a condition that presents as vulvar pruritus and pain with porcelain white vaginovalvular atrophy. It is most common in postmenopausal women, though it does occur on occasion in younger women and girls. While all of the other conditions listed can cause pruritus and pain, none of them are associated with frank atrophy. All of the following are part of the EMSL criteria for bacterial vaginosis except A. Thin gray or white vaginal discharge. B. Vaginal pH greater than 4.5. C. A positive whiff test on addition of potassium hydroxide to the vaginal discharge. D. All of these are part of the EMSL criteria for bacterial vaginosis. The answer is D. All of these are part of the EMSL criteria for bacterial vaginosis. The EMSL criteria for bacterial vaginosis are as follows: clue cells seen on microscopic examination, a positive whiff test on addition of potassium hydroxide to the vaginal discharge, a vaginal pH greater than 4.5, and thin gray or white vaginal discharge.